when you have a really difficult speaking group, the best thing to do is to read the audience. So how are they difficult? Are they looking bored? Are they looking like they need to get up and move? The question becomes, what do they need from me? It's like, and I'll even ask that if there's like a little bit of a dip. It's like, I'm curious as to what you're thinking right now.
What are the pros of that behavior? And what are the cons of that behavior? And then again, what are the pros of not doing that behavior and the cons of not doing that behavior? So that's the skill. And here's a little chant thing that I wrote for my group, but it goes like this: pros and cons, pros and cons. Think about the consequences when I feel my urges. Think about the consequences when I feel my urges. Stop and think, stop and think. So anyway, I teach that to my adolescent group, and one day we had this one patient that was discharged that was readmitted. So this girl comes up to me and she says, "Miss Deb, I was at my placement and the girls were teasing me, and so I climbed up on the barn to jump off the roof. And once I got up there, your pros and cons song came in my head and I had to get down."
Having this chord, be confident in knowing that no matter what notes you play, you're going to be playing a G, a B, or a D, even though some of them are repeated. So once again, here's the exercise: 1 and 2 and 3 and 1 and 2 and 3 and 1 and 2 and 3 and 1. Now fill it in, and 3 and 1 and 2 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 and 3 and 1. So there's our chord.
For rapport building and as an icebreaker with kids especially, it's a hilarious talking robot. Well, singing robot really. It's a real great icebreaker, rapport builder. Basically when you touch the screen, I can set it right now, it's set to a scale, C minor, and I'm just going to interact with Megan. Okay Megan, see what happens when the robot sings.
In the sound environment. And that's how we make meaning out of language as well. The same way of working, the same ability, this echoic memory helps us to be able to actually listen to a phrase and make meaning out of it. Now the reason this is meaningful, the reason this is important, is because we can use it as assessment in music therapy. Knowing that it's 3 or 4 seconds long, we can actually use that as assessment to find out if there's a delay in processing. Right? We can actually time it, and we can start to get a sense of, is the echoic memory working properly with this person by talking to them and they respond, or by making sounds together and they respond, or by improvising together. And we can time that. We can find out the health of their echoic memory.
I think that, well, for those of us who live in the U.S., there is a lot of conversation and debate about what healthcare looks like and how we can most effectively provide it. And I think that as music therapists, we can play a significant role in helping change the healthcare system to become more patient-centered, more compassionate, more honoring of how quality of life affects one's health and well-being. And while I would like to see that happen throughout the entire healthcare system, hospice is a great place to start since it is focused on providing comfort and enhancing the quality of a person's life at the end of life.
It offers opportunities for many different types of learners. So there are those that are more kinetic and movement learners, where the movement and dancing is something where that's how they learn. There are those that are more didactic learners, that really, the words in the song, the message is how they learn. There's visual learners who really learn by watching, whether it's music videos or reading the words of the song. And there are the experiential learners who really like to practice the skills in real time. So there's just so many different approaches for so many different kids. And music in traditional kids music really is based on learning skills, whether it's if you're happy, you know, clap your hands or ring around the rosy or duck, duck, goose. Those are really social skills training songs. They're teaching kids about feelings. They're teaching kids how to work together. It's really baked in the cake. Kids are really primed to use music as a way to learn and grow.
Individually. Recall the most famous musical guest of the Lawrence Welk show, the Lennon sisters, Duke Ellington. Play some of the music. What songs do they remember from that time? I think Lawrence Welk is huge for the seniors, at least that I've worked with. Talk about the legend of Johnny Appleseed. Sing the Johnny Appleseed song. Create art using seeds. These are just things. And as they're doing that, they're listening to Lawrence Welk. They're seeing a short video on an old Lawrence Welk show. So you're kind of connecting them to that time. And they're
we are using our services to be paid and get reimbursement either from private patients or from health insurance companies makes us a healthcare provider and subject to this HITECH Act. The HITECH Act now tells us that we have certain responsibilities when we hand data to somebody else. We have certain responsibilities when we store our data in the cloud. We have certain responsibilities when we are aware or when we become aware that our data have been breached, that somebody stole the data of our clients. But few of us actually know what the federal regulations are and how to safeguard ourselves.